So continuing on with insurance, again, we're focusing on the various financial instruments that you'll be encountering throughout your entire life. And obviously, health insurance is a very, very large represents a very large portion of your insurance portfolio, if you will. So we've already talked about home, property insurance. We've also talked about auto insurance, which these are large chunks, but also when we talk about getting into health insurance and disability and long-term care insurance, these are things that when you're younger, you have a tendency to, health insurance, of course, that's something that's always out there and should always pay attention to, but disability, we think of less, and long-term care insurance, we even think of even to a lesser degree. But the problem or the reality is with long-term care insurance, for example, we all have older people in our lives, people that are in nursing homes, in some sort of home care facility, whether they're getting home care or they're in some sort of an assisted living type of arrangement, that gets very, very expensive. And if you're not aware of that, you should be. Okay, anyways, we'll be talking about these things, of course, as we're walking through. So onward. So the objectives in this case, again, I'll walk through these, explain why the cost of health insurance and health care have been increasing. Lots of different reasons along those lines, and we'll get into that as we go forward, of course. I'll refrain, let's just walk through the list. Define health insurance and disability income insurance, or insurance or insurance. People, it depends upon where you're at in the country, the way they pronounce insurance or insurance. It's just a weird way of expressing. Anyway, explain their importance in the financial planning. Again, this is all part of your financial, your personal financial picture, your pie, so to speak, if you will, when we're talking about budgets and so forth. Analyze the benefits and limitations of various types of healthcare coverage. Evaluate private sources of health insurance and healthcare. Appraise the sources of government healthcare programs, and finally recognize the need for disability income insurance. Healthcare cost, first off. So explain why the cost of health insurance and healthcare have been increasing. The United States has the highest per capita medical expenditures of any country. There are a lot of reasons why that is the case. The average per capita cost for healthcare was estimated at $11,670 in 2019, or $1,000 per month, right? The amount is twice as much spent in healthcare as the average 24 industrialized countries in Europe and North America. There are a lot of different ways of looking at this, but there's, without a doubt, we pay more. There are a lot of different ways this is sliced up, but in toto, we pay much, much more than most other countries. So, high medical cost. Healthcare costs are estimated at $3.9 trillion, or about 20% of the GDP. The overall production in the country of that, about 20% is attributable to or goes toward spending on medical costs, period. Okay? Expected growth to continue, to double, let's just say 5.7 trillion by 2026. It'll probably be up in the 7 trillion range by the year 2030. Yet about 32 million people have no health insurance, and there are a variety of reasons for that, and we'll see how much we get into that. This becomes more of a political debate in many cases, but things worth talking about, and I will get to that in a minute. So there are high administrative costs, 11% of healthcare dollar versus 1% in Canada, for example. Administrative costs that are associated with hospitals, on the government side, there are huge administrative costs associated with programs like Medicare and Medicaid, for example. So how much does this healthcare cost? Why does it cost so much? Again, using sophisticated, expensive technologies. So let's talk about this for a moment. So when we talk about technology, the reason that we employ technology in the first place is that we want to become more efficient. That's why we apply technology. So in order to become more efficient, what that should do, in theory at least, is to reduce cost. However, especially when we're talking about medical care, we're always trying to push to improve our grasp, if you will, on medicine and improving and extending life and so on and so forth. And that's a very expensive process. This applying this technology, yes, it does reduce costs kind of going forward. However, the upfront costs are significant in terms of research and development, and just think about something as commonplace today as an MRI machine, a magnetic resonance imaging machine, a super X-ray, if you will. That's something that, frankly, 10, 15, 20 years ago, first off, it wouldn't have been around. Maybe 20 years ago, I'm not sure how long it's been out there, but very early on, it was extremely expensive for these MRI machines out there, and they became more prevalent and the cost went down, but their initial buy-in is very, very expensive, and it added significantly this technology, if you will. Duplication of tests and technologies. This happens because, frankly, doctors are directed, or advised, or required to administer a lot of these tests, and it just goes without saying. And if you haven't had the experience of this at this point in your life, you may know it because of older relatives, friends, etc., that have gone through this. The testing process is mind-numbing. The blood test that you go through, so on and so forth, and the technology that's employed, again, the duplication of these tests and the technology that's applied, it just adds a tremendous amount of cost, if you will. Increases in the variety and the frequency of treatments. And this is what this really boils down to, is that the more we learn, the more we have to learn. And this is certainly the case in medicine. The more that we get our heads wrapped around, our arms wrapped around dealing with various medical conditions, the more it uncovers other more diseases, more problems, and so on and so forth. This is not a bad thing, don't get me wrong, but it's just that it's peeling an onion. You're getting more and more that rather than you're eliminating some things and other things are cropping up. Anyway, increasing number and longevity of elderly people. This kind of is a result. This is a good thing, right? And people live longer. And so don't pull the plug on me, please. No, but people live longer and their quality of life is much better as well. Witness the increased is the extended life that we have, extended the quality of life. You have older people now, if you will, that are in much, much better shape, physically certainly, than they were even 10, 15, 20 years ago, the same age group, if you will. Regulations that could result in cost shifting rather than cost reduction. Regulations, they're out there for a reason. However, added regulation, whenever you see regulation, think cost. There's added cost. And it's not just cost shifting, but adding cost. So the idea is that you put regulations in place to protect people and to make things run more smoothly, but in reality, what typically happens with regulations, adding more regulations, is that you end up with what? You end up with more cost at the end of the day. So something that would have been relatively simple process 10, 15, 20 years ago or more has become a bureaucratic mess, if you will, today. increasing number of accidents and crimes that require emergency medical services. This is interesting. There are more people, so you have more accidents. More people means equates with more medical emergencies and so on and so forth, if you will. But the interesting thing to note is that this is an aside. Automobiles, for example, have become much safer, period. Okay, so on we go. So again, I'll just run through these. So labor, it's become much more labor intensive, meaning it's your home health care, for example, is something that really wasn't around much before, and it's something that it's helped to reduce overall costs rather than having people in the hospital. However, you still have to pay people to deliver that home health care, especially when you consider things as the baby boomers, people that were born from 1946 to 1964. They're a large portion of the population, and many of them are moving into retirement years, of course, and in need of increased amount of medical care. This increased demand for healthcare workers is what driving up wages, if you will, for healthcare professionals. Using more expensive medical care than necessary. This is again better to err on the side of caution. This is again goes back to duplicate testing and so on and so forth. The increased amount of medical malpractice insurance and fraud associated with that. This is driving cost up because remember, if a doctor has to pay higher malpractice insurance, then that doctor has to do what? Has to pass that cost on to the patient, if you will. Built-in inflation in healthcare delivery systems. This is something that a lot of this is government-driven, if you will. Again, back to what I said before about the aging baby boomers, and there's no way around that. This is it. It makes in many cases it makes a lot of sense to have that there is an increase, if you will, in the costs that are associated out there based solely on the large portion of the population that are moving into that 65 and over category. So careful review of fees and charges, and this is what we're looking at. On the plus side, because of employing the technology associated with computers and so on and so forth, we're getting better at understanding these fee structures and being able to kind of drill down on those, right? So establishing incentives for preventive care, so you reach out to your patients, and the longer they remain in good health, the things that they can control, diet, not quitting smoking, cutting back on drinking, increasing exercise, that helps in terms of reducing the amount of medical intervention, if you will. So involving community and balancing the healthcare needs and healthcare resources. This is very typical, especially with the elderly population. Encouraging prepaid group practices. This is something that's called, I forget the term, it's kind of where you pay an annual fee, if you will, for a primary care physician. And what you do is you pay maybe $1,000 a year or whatnot for you to go to this primary care physician, for them to take care of most all of your needs. And so it's able to, that drives down the cost because it cuts back, it forces the doctor to try to address issues with patients up front more carefully, address them more quickly. Support community health education programs so people will take better care of themselves. Again, especially with situations like with diabetes, it's endemic. It's a problem that is across the board, and it's increasing. And so the more education programs, dietary programs. The more that there are available out there, the better off it is for the individual patient and the cost to society as a whole. Physicians encourage patients to pay cash for routine care, meaning you can get a cut rate. So if you don't go the insurance route, insurance is always more expensive because of what? The administrative cost. So if you can negotiate, and this is something that happened, this is common in the distant past, but probably about 10 years ago or so, it became much more important because many people lost their health insurance, and so they began to negotiate directly with doctors, with the physicians' offices, and paying cash up front. You're able to pay less because then the hospital doesn't have to go through the typical billing cycles, not the hospital, but the doctor's office, if you will. Okay, so what can you do to reduce personal health care costs yourself? Consider participating in a flexible spending account, an FSA. This is you're spending with pre-tax dollars, and this would be something through your employer that you would be considering high deductible health plan, which is in conjunction with that FSA, or rather a healthcare spending account, where the high deductible, meaning that you would be, of course, paying a lower premium, and more of your expenses would be coming out of pocket, and you could pay for those expenses again with pre-tax dollars. It's kind of things have become much more flexible over the years. Ask for less expensive generic drugs. Don't get if you need the brand name drugs, you need the brand name drugs. There's no way around that. However, typically if the brand name drug is typically more expensive, think about it in terms of buying Meyer brand milk versus Borden milk. The Meyer brand milk, the generic milk, is less expensive, if you will, and oftentimes it's the same exact milk that goes into each jug, and same thing with generic drugs. It's not always the case, but just something to keep in mind. Mail order or online pharmacy for long-term drugs, where you get 90-day supply of drugs and so on and so forth. These are all prescription drugs we're talking about. Review free and low-cost coverage for uninsured children through state. That would be Medicaid, okay? So Medicare is for seniors, people that are 65 and older. That's the insurance through the government. And Medicaid is for people that are indigent or low-income folks, right? And so this is what we would be talking about. There's another term, it's called CHIP. It's another kind of form of that Medicaid, if you will. So continued on, what can you do for reducing the personal health care cost? Review state plans for prescription drug assistance. A lot of programs out there. Contact if you're a member of like a Costco or some other larger. Usually, you can subscribe to their plans, and you could be eligible, if you will, for getting drugs at a significantly lower cost than otherwise would be the case. Follow up with the doctor by phone if allowed, meaning don't schedule another appointment. Talk to them directly, if you will. Investigate non-urgent procedures recommended by doctor. Look into these things. Is it worthwhile for you to get that physical therapy, or is it something that you can do on your own? Some exercise that you can program, that you can implement, that would be less expensive, for example, than going through physical therapy. I'm not telling you not to do the physical therapy, but there are a lot of different options that are out there. And always review your billing statement for errors. This happens over and over and over again, especially when you have insurance. It's called the explanation of benefits. And that's where your insurance company receives a bill, and they send the explanation of benefits along to you to indicate how much you owe in terms of your deductible, your co-insurance, etc. And appeal unfair decisions by your health plan. Example of this was that I had a COVID test fairly early on, and it turned out that I didn't have COVID, thank goodness. But I was continually billed month after month for getting that test, and I didn't understand, and I pressed my health insurance administrators, and I've finally ended up getting relief in the end, but only after I had already paid for it. But that's beside the point. You always try to follow up on these things. Practice preventive care. Make your appointments. Go to your get your annual physical, and so on and so forth. Right. So onward. Further things that you can do. Stay well. The way you stay well, of course, is by eating a balanced diet and keeping your weight under control. All these things that come on that I've already mentioned before, but are pretty straightforward. Avoid smoking and don't drink to excess. Get sufficient rest, relaxation, and exercise. Always critical to getting yourself back on track so far as your so far as your health is concerned. Always have to stay on top of these things. This is all part of what? Paying yourself first. Drive carefully and watch out for accident and fire hazards in the home, meaning, of course, that being a very, very defensive driver, which I'm sure everyone is, right? Maintain a healthy lifestyle. Do as best you can. Don't eat pizza 4 times a week if you can get away with it. Try to have a better balanced diet, and try to focus on things that you can control. Get recommended health screenings and manage chronic conditions as best you can. Stay on top of these things, right? So health insurance and financial planning. Health insurance, disability, income insurance, and explain their meaning and importance of financial planning. So health insurance reduces the financial burden people suffer due to illness or injury, specifically. So illness or injury for health insurance, it's part of your overall insurance program, again, to protect your family's economic security, because as we all know, we've heard stories, and we may know this firsthand, or we may have family members, or our families have been impacted by these things. You really, really have to stay on top of your health insurance. Includes both medical expense insurance and disability income insurance, okay? So it's kind of looking at it, the holistic approach, if you will. So Tax Cuts and Jobs Act of 2017 requires large employers, 50 or more, to provide health insurance to cover all employees. These are the things that went along with what it was termed the Obamacare, and so on and so forth, that all the things that kind of went along with it. And Department of Labor expanded access to affordable health care, again, coverage options for small business and their employees rather. The group plan comprises about 90% of all health insurance. So whether you're working for someone at this point or not, if and when you do start to work there, in most cases, you will be offered an option to join a group health plan, if you will. So most are employee sponsored, and an employer pays for a portion of the cost. So it's a cost sharing. In the past, they would pay for everything, and that's no longer the case, people. Anyway. So again, we already talked about the Portability Act, which basically says that when you move from job to job, you will be able to get health insurance, if you will, no matter what. So individual health insurance and supplementing your group insurance. This is when we go above and beyond, if you will. Individual health insurance plans, policies tailored to your particular needs from the company of your choice, usually very expensive, or typically much more expensive. Supplementing your own group insurance, with your employer, for example. The coordination of benefits provision in a policy says that the benefits received from all sources are limited to 100% of allowable medical expenses. So what we're saying is that you're not double paying, is really what it kind of boils down to when we're talking about the supplemental insurance plans that are out there. This is their objective, is so you're not gaming the system, if you will. Okay, medical coverage and divorce. Coverage under a former spouse's medical plan can be continued for 36 months, and premiums are paid entirely by the individual. This is a COBRA plan, if you will. And COBRA, again, is another, requires many employers to offer employees and dependents the option to continue their group coverage for a set period of time following a divorce or some separation from the company, if you will. But divorce in this case is what we're focusing on. Does not cover federal employees and religious institution employees. The types of health insurance coverage, analyze the benefits and limitations of the various types of healthcare coverage. A good group health insurance plan should offer basic coverage for hospitals and doctor bills. Provide at least 120 days hospital room and board. Provide at least $1 million to lifetime maximum for each family member. Pay at least 80% out of hospital expenses after annual deductible of $1,000 per person or $2,000 per family. Oftentimes it's quite a bit more than that, but the idea is that there are limitations. Impose no unreasonable exclusions, limiting out-of-pocket expenses to $4,000 to $6,000. That number is probably a bit higher now, but it's about that, within that framework. So it's limiting your overall liability, how much you would have to pay in the event of some major catastrophe, if you will. So types of medical coverage, again, hospital expense insurance, hospital room and board and other charges, so things that are associated directly with the hospital, surgical expense insurance, surgeon's fees for an operation, physician expense insurance pays for physician's care such as office visit, lab test, and x-ray. So these are three different items that we're looking at. Hospital insurance, paying for the hospital, surgical, paying for the surgeon that is performing the procedure, physician expenses for office visits, if you will, your normal, typical medical expenses. So it does not, that last bit, of course, it does not include surgery. Major medical expense insurance, this covers the expense for serious injury or long-term illness, and it's added on, if you will, to that basic plan that we described before. It has a deductible, co-insurance, and stop-loss provision. Okay, so comprehensive major medical insurance, low deductible offered without a separate basic plan. So this is all together, if you will, with the previous. Covers hospital, surgical, medical, and other bills. So it goes above and beyond. The hospital itself, we're looking at hospital indemnity policies, how they protect themselves, pay cash benefit, pays you rather a cash benefit when you're hospitalized. Dental expense insurance covers exams, typical Delta Dental, and so on and so forth. Your normal 6-month checkup, if you will. Vision care insurance, exams, contact lenses, and glasses to a point. Other insurance policies, dread disease, trip accident, and cancer policies focused on unrealistic fears. They're a poor value because it goes above and beyond what the norms are, if you will, out there. And they tend to frown upon these because it's an added expense that you could typically, you're better off not even going through that, right? So deductible and co-insurance example, we'll use Ariana here with has an $800 deductible and co-insurance provision requiring her to pay 20% of all bills. So if her total is $3,800, for instance, the company will exclude that $800 from coverage, which is coming out of Ariana's pocket. And then thereafter, they will pay 80% of the remaining $3,000 or $2,400. Therefore, Ariana's total cost would be the $800 for deductible, and then that co-insurance piece of $600 that would be on top of the $3,000. It would be a portion of the $3,000, 20%, right? So, long-term care insurance. So it was virtually unknown 50 years ago. This was because this kind of came about with the baby boomers, the whole concept of long-term care insurance. Typically in the past, people would be taken care of had at home by family members until they reached a certain point, and oftentimes people would die at home. And it's something that's rather new, and it's growing faster than other forms of insurance. A recent study by Americans for long-term care found that 1 out of 5 Americans over 50 at risk of needing some form of long-term care within the next 12 months. Scary proposition. That when you start looking at these probabilities, more than half of the population will need some sort of long-term care at some point, and it can be very expensive. Nursing homes are very expensive, and if you have loved ones in nursing homes, you understand how that is. So the average national average of 1 year in nursing home can cost over, we'll just say $100,000. It's very, very typical. Depending upon where you're at, services, what's involved, they can certainly hit that $100,000 mark, or think about it as $8,000 a month. Very expensive rent, if you will. Annual premiums are range anywhere from $2,000 to $16,000, and we'll get into this, I'm sure. But the takeaway is that with long-term care insurance, the younger you start on this, the better off you will be. So it's just something to consider. So major provisions in a health insurance policy: eligibility varies with age, marital status, and dependency. Assigned benefits: insurance pays your doctor or hospital directly, so it's a third-party payer, if you will. Internal limits: fixed amount paid per day for a hospital room. This is, again, based on whatever the criteria are out there with your insurance, right? So co-payment, cost sharing in the form of a flat dollar amount you pay. So if you've got if you go to a doctor, you have a co-payment of $20 or $30 per doctor visit. The idea is to prevent you from going to the doctor for anything and everything, abusing the benefit, right? Service benefit, entitlement to specific care rather than a fixed dollar amount per procedure. Benefit limits: maximum dollar amount or maximum number of days in the hospital per annum per year, lifetime as well. Anyway, these are all things that are specified in your insurance policy. Exclusions and limitations, coordination of benefits that we'd already mentioned before. The coordination of benefits, what that means really when it comes down to it, as I said before, if you've got two types of insurance, you have your health insurance and you also have insurance vehicle with your auto insurance. And there's often the discussion of coordination of benefits. Do you have coordinated benefits or not? And if you have the health insurance and you have the auto insurance, that has to be coordinated. This is the coordination of benefits that we're talking about. Coverage under more than one policy is what we're driving at. Guaranteed renewable, meaning that you can't be denied renewing that insurance, whatever that insurance might be. Cancellation and termination: these are, again, the policies that are associated with it, what drives it, explain these. It has to explain the circumstances associated with that. Reimbursement versus indemnity: reimbursing means to pay you back for something. Indemnity, it protects you from, it makes you whole again, if you will, and we'll get into that as we go forward. Internal limits versus aggregate limits. Aggregate is overall, the overall limits. The internal limits are as defined within the scope of that policy. Deductibles and co-insurance: deductibles are how much you have to pay up front before your insurance kicks in. So you've got a $500 deductible, back to that example. So you've got a $1,000 bill. Your $500 deductible comes out first out of your own pocket, and then the additional $500, if you have a 20% co-insurance, then you would be paying 20% of the $500, the additional $500. So out of that $1,000, you'll be paying $500 in deductible and $100 in co-insurance. Out-of-pocket limit: that is how much you ultimately pay out of your own pocket for a given period of time, per year is typically what it says. This is after you've met your deductible and your coinsurance when you reach that limit, how much you're totally on the hook for, if you will. Benefits based on reasonable and customary charges, and this is determined by the insurance company. So for medical insurance, again, reiterating what we had talked about before, there are three choices. One is the basic. Second, it would be major medical. And the third would be the combination of basic and major medical. Basic covers the basic charges that we talked about. Major medical is catastrophic, something that happens that where you start running into bills, $10, $20, $30, $40, $50,000 bills. And when you combine the two, you have both coverage. This is more of a comprehensive. So evaluate private sources of health insurance and healthcare, private insurance companies, individual policies. There are such things, of course. You can buy insurance on your own. You may do that right now, or your parents may be doing that right at the moment. Group policy is sold through an employer. If you're working for someone, typically you have the option. You're eligible for whatever that group policy might be. Hospital and medical service plans, such things as Blue Cross. And so this was Blue Cross Blue Shield. It's a typical, it's the major provider for most people. I'm not saying everybody has Blue Cross Blue Shield, but most people are familiar with it. Blue Cross takes care of the hospital care benefits, and Blue Shield takes care of the surgical and medical services. So this is the combination of the two. Blue Cross hospital, and the Blue Shield is the surgical. Blue Cross pays for hospital, Blue Shield pays for the surgeon, and also the medical services, if you will. HMOs, health maintenance organizations, these are managed care where you're prepaid health plan for comprehensive health care, two members rather. So you're paying kind of upfront for your medical care going forward through the year, for example. Best known again as HMOs and PPOs. HMO is again health maintenance organization, and PPOs are what is the term? Anyways, PPO. It'll come to me after I'm done with this, but it's similar to an HMO where your preferred provider is what we're saying. So preferred provider organizations. So it focuses on focus on your primary care physician, meaning you go to your primary care physician and they're the ones that direct you to specialists if there's a need. HMO contracts with selected care providers, fixed prepaid monthly premium, focus on preventive care, basic and supplemental services for that one provider, if you will. So again, preferred provider organization, the PPO, several providers to choose from, cost a bit more than an HMO typically. Specified services at predetermined fees to PPO members. So the members, the doctors, have to agree to these fees is really what it comes down to. If you go to a non-PPO provider, you end up paying more, right? It includes EPOs and POS plans as well. Home health care agencies, something I referred to before, home health care aid and hospices within the home itself. So you have nurses that would be coming in and so on and so forth. Employer self-funded health plans. Company collects premiums and pay medical benefits, may not have the assets to cover medical costs that exceed those premiums. This is something that, this is why typically when you're self-insured, they watch them very carefully, these companies that are self-insured, to make sure that they have enough, they're collecting enough in terms of premiums. New healthcare accounts that have been added of late within the last 10 years, health savings account, health reimbursement accounts, and flexible spending accounts. HSA, health savings account, these are monies that you can set aside on an annual basis, and they're tax-free, and you can use them or not use them, and they carry forward going forward, and you'll be able to set those aside for future. They're usually paired with high deductible plans, in particular HRA, health reimbursement accounts, are very similar. Flexible spending accounts, these are annual amounts that are set up where you have a certain amount that's taken out, pre-tax dollars, and you use that to pay such things as deductibles, co-insurance, and so on and so forth. And the one thing to note about flexible spending accounts, they're very good. However, the downside is that if you don't use them, you lose them after 1 year. So you have to really be careful about that. Looking at the government side of healthcare, Medicare is a federal program for those, again, the older folks, 65 and or older, and the closer I get to 65, the younger 65 actually looks, and also includes some certain disabled people that are on disability, are eligible for Medicare. There's Medicare Part A, that's the hospital insurance, and that pays for your hospital care, inpatient skilled nursing facility care, home health care, hospice care. That's Part A. Part B is your medical insurance, and that is voluntary, and you pay doctor services that are not covered in Part A. Remember, hospital versus like your normal basic, if you will, your Part B coverage, if you will. So Part C is your Medicare Advantage plan. Part D is your Medicare prescription drug plan benefits. These are all things that are add-ons, if you will, to Medicare Part A. And Medigap or MedSup, I guess it is, insurance, may pay what, this is your supplemental. And what's interesting about this is that this is where you have insurance on top of your Medicare, your A, B, C, and D, your prescriptions, etc. You can buy additional healthcare, supplemental healthcare, if you will, to reduce your deductibles and your co-insurance, if you will. Your deductibles is really what it comes down to. Medicaid, so Medicare is for older folks, and Medicaid is for low-income individuals and families. State administered with federal guidelines. They're monies that are granted from the federal government to the states to dispense with as they see fit. So the Patient Protection Affordable Care Act of 2010 offers tax credits for small businesses. It goes through the whole litany of things, but the things to point out. One of the things is it allows children to up to age 26 to remain in their parents' plans, meaning if their parents are on a group plan, they can remain on that group plan until the age of 26. Prohibits lifetime caps on coverage, restricts use of annual limits, provides consumers with access to an appeal process. There are a whole number of things that are out there that are in many cases very beneficial, but remember, when it's beneficial, that means that if there's a benefit, there's a cost that's associated with it as well. Increases in numbers of the funding and numbers actually of community health centers. Premium increases must be justified, and the premiums do go up. It keys on expanding Medicaid, the Medicaid program. Employers with 20 or more employees must provide insurance. So the individual shared responsibility provision requires you and each member of your family to have minimum essential health care coverage every month. And a lot of this has been somewhat done away with, but it's still something that it may come back again. Have an exemption from the responsibility to have a minimum essential coverage, or make a shared responsibility payment when you file your federal income tax return. Starting in 2019, the Tax Cuts and Jobs Act repeals the ACA individual mandate. So that went away, but again, that may well be coming back again. Fraud and abuse, 1997 and implemented. So there's a huge amount of monies that are going to into Medicare and Medicaid, and so when you have a lot of money flowing, you can be darn sure that there's going to be some fraud and abuse associated with it. Tougher guidelines were established. Nonetheless, we see this over and over again, where we see this massive schemes that are scams, schemes that are done where physicians end up going to jail because of Medicare fraud, Medicaid fraud. Anyway, there's a long list of those that are, there are always some bad actors out there, if you will, right? So at any rate, so government, private health insurance, what's Health Finder, Medline Plus, NIH, National Institute of Health, Health Information Page, FDA, the Food and Drug Administration. Now we're moving on to disability income insurance. Now, there's the disability income insurance protects the most valuable asset, your ability to earn income. Meaning, again, that if you are no longer able to work, or if you're no longer able to, how should I put it, perform 100% in your job. Sometimes there's partial disability. Anyways, we'll get into that as we go forward. Disability is more likely than death at any age. Provides regular cash income lost as a result of an accident or illness. It's insurance. If you become disabled, your income group drops, but your income rather drops, but your medical expenses go up. So this is to address that issue rather. So this is, again, disability and income insurance. Definitions of disability. Some policies define it simply as inability to go to your regular work. Good disability plans pay you when you are unable to work at your regular job, right? Poor disability plans pay only when you're unable to work at any job. So if you can't find any employment, it's far more restrictive, if you will. Disability insurance trade-offs to buy it in disability insurance or not. There's always part of disability within the framework of Social Security. It's called SSDI, Social Security Disability Insurance. It's the group together. There's a waiting period or an elimination period. So there's a period of time, 60, 90, 120 days. The duration of benefits, how long that disability insurance would be in place. The amount of your benefits, if it's based on your salary, is it 60% of your salary, 75%, 100% of your salary, so on and so forth. Accident and sickness coverage, if that's included, if you have an accident or you become sick. Guaranteed renewability. This is back to that same idea once again about can you be excluded at some point in time from buying this disability insurance. So sources of disability. This is where we get down to the nitty gritty, the substance of this, and typically group employers have group disability plans. They can be short-term disability or long-term disability, or both. You can have short-term disability and long-term disability. Short-term disability may cover you for a year or less. Long-term disability may be may kick in after that waiting period, which is the short-term. Most insurers limit benefits from all sources to no more than 70 to 80% of your take-home pay. Because this is non-taxable. Social Security covers total disability that lasts more than 12 months, and you must be unable to do any work, right? So this is the umbrella policy, if you will, through Social Security that I mentioned before. Workers' compensation applies if your accident or illness occurred at your place of work and resulted from your type of employment. You're a lumberjack and you're swinging an axe all day, every day, and you reach the point where you wear out your shoulders and your elbows and your back. And at that point in time, workers' compensation would kick in, for example, if you're injured on the job or whatnot.